shillings, moving from 166.54 shillings to 206.84 per litre. Following the revision, diesel will now cost 196.63 shillings per litre. Meanwhile, the price of kerosene remains unchanged at 152.78 shillings per litre. The latest move by EPRA offers some relief to consumers who have been grappling with the sudden surge in fuel costs earlier in the week. Now, to matters health, the government has announced plans to pay 4 billion shillings onto health facilities across the country. Health Cabinet Secretary Aden Duale says the funds will be released by next week as part of supplementary budget. Facilities on less than 10 million shillings will be paid first. This step is meant to support smarter hospitals that have been hit hardest by financial challenges. The remaining debts will be reviewed and included in the 2026 to 2027 financial year budget. Payments for those balances are expected to begin in July. Public, private, and faith-based health facilities have been struggling due to delays in payments for services previously offered under the NHIF.
That was passed. We have allocated 4 billion shillings, ready for payment next week. And these are people who owe the former NHIF between 1 shilling to 10 million.
This the final bit of the work that is being undertaken by the Benefits Package Tariffs Advisory Panel, the menu that we are going to offer Kenyans. This work is ongoing and is shared by one of us, Professor Walter Jaoko. We are reviewing the entire package that we offer under Social Health Authority, and this is the right time for you to be able to bring your considerations into this discussion.
Work that has been done, be paid for. We cannot be begging a finance system to pay us for work that has been done. And therefore the challenges that the Social Health Authority is having in not paying those who have actually done work should be rectified, and Kenya Medical Association will assist.
Now, to a sad story, 2 families in Ishara, Embu County, are mourning the loss of their loved ones who were shot dead during protests held on Tuesday. As they prepare for burial arrangements, grief has quickly turned into calls for justice. The families insist the victims were unarmed and were peacefully exercising their constitutional right to demonstrate. One victim was fatally shot in the neck, while the other was shot in the mouth approximately 150 meters from Shiara Hospital. Residents have also raised concerns over the condition and response capacity of the local hospital, describing it as an inadequate during emergencies. The community is now demanding accountability from security agencies, calling for legal action against the officers involved. There are also growing calls for immediate transfer of the officer commanding station in Shiara police station as tensions remain high in the area.
Mauaji yake hakuwa kwa maandamano, aliuiwa kwa barabara, mbali na mahali maandamano ilikuwa. Ningetaka ama ningeomba msamaha kwa serikali ifuatilie hii mambo ili haki ionekane.
Tukakaa hapo kwa makaa mpaka kitu saa 9. Ndipo nilianza kusikia watu wakisema kuna vijana 2 wameuawa. Nikauliza hao ni kina nani? Nikauliza watu, simuende mniangalilie ama ni watoto wangu. Ndio wale watoto walikuwa wanacheza na Kariuki hapo awali wakiwa wandogo. Ndio nilikubali sasa Kariuki kabisa. Sikuenda kumwangalia. Nilisikia vibaya. Kijana yangu ndiye tunasaidiana na yeye.
And still on that, leaders in Embu County have strongly condemned the fatal shooting of protesters by police during demonstration in Shiara, Mbeere North, where 3 people have now died from gunshot wounds. Embu Governor Cecil Mbarire criticized the use of live bullets on unarmed civilians, calling the incident unacceptable and demanding immediate accountability. She has also urged a swift and transparent investigation to ensure those responsible are arrested and prosecuted. Embu County Commissioner Nyanala Wanyonyi also expressed concerns, saying the use of excessive force is not legally permitted. He confirmed that officials from the Independent Policing Oversight Authority, IPOA, are expected in the area to begin investigations. Authorities are now urging calm as inquiries into the deadly incident get underway.
It has come to my attention following demonstrations that took place today at Ishara in Mbeere North that we have tragically lost 2 young men, while another sustained injuries as confirmed by the police commander. I strongly condemn the use of excessive force, including live ammunition against unarmed demonstrators. Such actions are disproportionate and unacceptable.
And the Senate Health Committee has raised serious concerns over the state of healthcare services in Baringo County following an inspection visit led by Chairperson Jackson Mandago. The visit quickly turned into an emergency assessment after the committee discovered poor infrastructure in several county hospitals. Many facilities were found in poor conditions, with buildings in need of repair and basic services lacking. The team also reported a shortage of essential medicines, leaving patients unable to access proper treatment. In addition, several medical devices were found to be non-functional, further weakening service delivery. The findings have highlighted urgent gaps in the county's health system, raising concerns about patients' care and access to reliable medical services.
Ceiling zikaanza kutoka. Sasa tumejaribu kwenda kwa county government watusaidie, lakini they have delayed. They have delayed to assist us.
But of great concern is how the county government themselves vandalized the equipment that were in those facilities. The theater, the machines that were there.
El Damaravin is among the biggest hospital facility. It's among the facilities that receives a lot of patients. And surprisingly, even these honorable senators, they were asking me why we don't have a CT scan and dialysis machine in El Damaravin. So I'm wondering when our budget chairman tell us you spend about 3 billion.
Watu wa Baringo County wamehangaika hapa na pale. Hapa hata Panadol. Kuna mtu alikuja hapa juzi kuanzia asubuhi mpaka jioni. Pale baadaye hata ukitaka kwenda kutafuta Briton unaambiwa enda nunua Briton nyumbani.
How I wish the governor and his executive and his members of the county assembly can come and look at this facility. This is so embarrassing. It is so depressing. It is so sad. As a Kenyan, I am shocked that these things do exist in our country. A beautiful health center which has just been collapsed into zero. And you know these things collapse because of corruption.
And teachers in Meru County have threatened not to report back to school after the April holiday if their concerns are not addressed. They are urging the Teacher Service Commission (TSC) to act on several issues affecting their work and welfare. Their main demands include permanent and pensionable employment for junior secondary school teachers, payment for those who marked NEC exams last year, and improvements to the Social Health Authority SHA insurance scheme. They are also calling for more independence in the management of junior secondary schools. The teachers say they will not stay away from classrooms. They will stay away, from classroom until their issues are resolved.
Jambo tunauliza ni hili. Kwani sisi tutateseka hadi lini? Familia zetu zimeharibika. Sisi wenyewe hakuna pesa mfukoni. 7,000 unalipa nyumba, kodi ya nyumba. Pale kidogo unasaidia familia, unakuta ya kwamba hakuna kitu unabaki nacho.
Chenye tunaomba serikali yetu na chenye tunadai kwa serikali yetu ni kuconfirm walimu wote the 44,000 in Kenya ambao ni interns wawekwe katika program ya PNP. Kitu ya pili ni kitu inaitwa autonomy. Tuko shule zenye tumewekwa pale, shule za msingi, na sisi kama walimu wa JSS hatuombi tupelekwe katika senior secondary schools. Tunaomba mahali tupo tupewe autonomy yetu.
Sisi tuli maki mtihani, tuli supervise, na hiyo mambo ilikuwa ya November December. Mpaka wa leo April walimu wanalia kulipwa.
Sisi mkataba wetu wa TSC na SHA tayari umeanza kuporomoka na hujamaliza hata miezi 6. Kwa hivyo tunasema kama SHA inafanya kazi, wacha ifanye kazi kwa mwalimu.
Sisi kama walimu wa kike tunakatwa pesa inaenda kwa mnyama anaitwa Kewota, ambayo wanasema ni Kenya Women Teachers Association ama Welfare Association. Sisi hatujui hiyo pesa zinasaidia nani. Kwa kaunti hii yetu ya Meru hatujapata hata mwalimu mmoja amesaidika na hiyo welfare.
And moving on, the Independent Electoral and Boundaries Commission has urged citizens to come forward and register as voters in order to take part in choosing accountable and responsible leaders. During a public awareness event on leadership matters, stakeholders emphasized the importance of reaching voters across the country to ensure they understand the value of electing deserving leaders. They noted that plans have been put in place to engage the citizens and educate them on civic responsibilities, especially the need to participate in voter registration and elections. Political and religious leaders have also been encouraged to take an active role in mobilizing the public, highlighting the importance of informed decision-making in leadership. The initiative aims to increase voter participation and enhance a democratic process for national development.
Na pia tukija katika county level tutakuwa tunaleta stakeholders mbalimbali pamoja kwa huu mradi kuweza kupiga msasa mambo ya bajeti.
Hivyo tunawaomba viongozi wa kisiasa. Ukweli ni kwamba wananchi huwasikiliza. Nyinyi ni viongozi wao, waliwachagua nyinyi na wao huwasikiliza. Kwa hivyo tunawaomba mjitokeze, muhimize watu wa Bungoma County wajisajili ili waweke kura zao kwenye kikapu.
Kati ya mikakati ambayo tumeweka kuhakikisha kwamba vijana ambao wako huko nje na hawajafikiwa ni kuhakikisha kwamba tumeleta wale wenye tunaita faith based leaders. Tuko hapa na religious leaders ambayo tuna work very closely na makanisa na misikiti kuhakikisha kwamba vijana ambao wanashiriki huko wanahamasishwa na wanajitokeza kwa large numbers register.
As those who are marginalized, let's take the initiative of registering as voters. Because once we are registered and we are a number, as Madam has said that you can negotiate on the table. We can have something to say as persons with a disability.
Now, a mass vaccination exercise against foot and mouth disease has started in Siaya County. The Department of Livestock and Veterinary Services is leading the campaign to protect cattle from the highly contagious disease. Farmers are being encouraged to present their animals for vaccination to prevent the spread of the illness. Officials say the exercise is important to protect livestock, improve productivity, and support farmers' livelihoods. The department has assured farmers that veterinary teams are available and ready to carry out the vaccination across the country.
Our value chains that have been prioritized, and dairy and also red meat are among the key value chains that have been prioritized by most of the counties under NAF-CDP. And I want to say that our objective as NAF-CDP is to increase market participation and value addition of the targeted value chains in the target community. And one of the challenges that we have had, especially with the dairy and red meat, is the issue on disease control. So the government, under the animal health and genetic delivery model, came up with this program so that we can address the challenges that are there on issues of animal health, in order to access the market, improve animal health, and also improve the incomes of the livestock farmers. What we have been doing under this program, we have farmers bringing in their animals for vaccination against foot and mouth disease. Because the challenges that farmers have, among other diseases, foot and mouth disease is one of the critical diseases affecting livestock farmers. And also in terms of cost, it also makes the cost of livestock production high. So this program targets vaccination against foot and mouth disease. The government subsidizes the cost of the vaccination. Farmers are supposed to pay 50 shillings, and the government, through the county government and also NAFCDP, pays 110 shillings for the farmer. So in total, the cost of vaccination is 160, but the farmer only pays 50 shillings for the vaccination. But we also have the muzzle, we are using the muzzle technology, what you saw there, that is for identification of the farmers. Today, this is just a regular vaccination exercise, but foot and mouth disease occurs in this county and even the neighboring counties frequently. But one of the roles of vaccination is so that we can be able to, is more like protective, so that the animals are covered against foot and mouth disease.
And Migori County has received a major boost in maternal health care following a donation of midwife kits worth 5 million shillings. The donation was made by Luala Community Alliance in partnership with Direct Relief, an international NGO. A total of 31 midwife kits were handed over, with each kit designed to support up to 50 safe deliveries. The initiative aims to enhance maternal health services and reduce risk during childbirth. Health officials in the county welcome the support, noting that the kit will help equip healthcare workers with essential tools needed to save lives.
A couple of weeks ago, I think last week, we received theater equipment valued at 4 million, and they have already been installed at our referral facility here in Migori. So mothers who are giving birth, children who are being born, and all the health-related issues that relate to the newborns and their mothers are in good hands because of the equipment that we have. So I want to thank Luala community for the donation that we received from them last week. I want to thank them profusely for the donation that we also received in terms of medicine. If you go to our facilities today, they are well stocked. Because of the support and partnership, the very good partnership by Luala community.
Donating midwife kits with support from our partner Direct Relief that contain essential supplies and medication and kits that are used during delivery. These make sure that the mother delivers safely, prevents infection, and saves lives in our facilities. These will go a long way in providing quality care for mothers, ensuring survival of both the mother and the child, as every mother deserves to have a safe delivery and every child deserves to see each and every birthday.
Now, in business news, Kenya is taking steps to include nuclear power in its energy mix as a part of its industrial growth plans. Leaders say the move will help the country produce more reliable electricity and reduce dependence on imported power. At a meeting in Kisumu, officials shared progress on the planned nuclear power plant in Siaya County. The project is expected to generate enough energy to meet growing demand and support local industries. The government believes that increasing energy supply will attract investment, create job opportunities, and enhance the economy. Plans are ongoing to ensure the project is safe, efficient, and beneficial to the public. Efforts to expand energy sources continue as Kenya looks for long-term solutions to power its development.
Entry level of Vision 2030, we need to produce at least 60,000 megawatts from the 3,000 we are producing. So we need to think in those quantums, and nuclear power is the only one which we can use to very quickly bridge this gap.
Nuclear power plant
is something that will last for like 100 years. So it's not just an energy project. It is more than that. And we have to work together with all stakeholders.
I have this belief that if SIA gets a primary investor that can help the lifting up of our economy, which is basically subsistence, then SIA is going to be a different place.
Consultation will not be a one-off thing. It will always be continuous, and there will be need for public participation before, during, and after. As a county assembly, we know our role. The legislative authority of the county vests in the county assembly.
Now, to support fair growth and small and medium enterprises, the Micro Enterprise Support Program will mobilize 7.2 billion shillings in credit. This will be done through 100 enhanced local financial partners such as SACCOs and microfinance institutions. Through the program, 250,000 farmers will be able to access affordable agriculture and green finance. In addition, over 375,000 farmers will be connected to organized and sustainable markets. This will be supported by 500 enhanced SMEs and cooperatives. The program aims to include 60% women and 50% youth as beneficiaries. It will also ensure that persons with disabilities and refugees are actively included in the agricultural value chain.
We want to catalyze green and climate finance investment in Kenya for a just transition, and we want to strengthen partner institutional capacity and risk management and mobilize more funding to support our agenda. You've heard about capacity building and how disintegrated it is. We want to make sure that in the next 5 years, we want to work with appropriate systems within the agri-sector to develop training materials that can be able to be easily accessible, whether virtually or through our training institutions.
We are very happy as government because what MESP has shown us is that it is important to promote sustainable financing, looking at the environmental conservation, climate resilience, climate financing, supporting farmers from capacity building to
And Kenya has officially recognized a new digital payment solution aimed at improving travel experience. Developed by Craft Silicon, the tourist app is now an authorized payment option across major tourism destinations. The app was unveiled during the Tap into Kenya event in Nairobi, marking a significant step towards modernizing the tourism sector. With the tourism app, both international and local travelers can make secure cashless payment at game parks, hotels, and various attractions. The platform uses NFC-enabled mobile devices, allowing users to complete transactions quickly and safely. The use of app, travelers simply download IT, enter TI or a payable number, and finalize payments with a tap and pin. This innovation removes the need for carrying cash or dealing with currency exchange, making travel across Kenya more convenient and seamless.
I am very delighted, therefore, to recognize Tourist Tap as a timely payment application for use by visitors across Kenya. And not only visitors, I was discussing with Kamal, and I think it will also be a convenient app for even local use.
Tourist doesn't have to bother about getting a local SIM card, getting a local cash, relying on other people to pay on their behalf. Everywhere you tap the card and you are in the business.
There has been a gap in the sector, and this gap is transactional. This is the digital integration which Tourist Tap is feeding today. Many of our operators have been relying on cash, creating a friction for both foreign and domestic tourists who expect seamless payment.
And Kenya's pork consumption remains low at about 0.4 kilograms per person each year, which is below the recommended 0.8 kilograms. Despite this, the pork industry already contributes around 19.5 billion shillings to the economy. Demand is expected to grow more by 125% by the year 2030. This growth is being driven by urbanization and changing eating habits among consumers. At an industry forum held with the Farmers' Choice, Principal Secretary for Livestock Development, Jonathan Mweke, explained that the government is working to address key challenges affecting the sector. These challenges include the high cost of quality animal feeds and frequent diseases outbreaks such as African swine fever. With proper support and investment, the pork sector has a strong potential to expand and meet the rising demands in the coming years.
Of goat, sheep, chicken, and beef, pig is the one that has the highest investment return for our farmers. That triggered us to pay quite some attention to this value chain, and we quickly developed a national pig value chain strategy that is guiding us through production, number one. Number two, market access. Once they produce, where is the market and what does the market want, in what quality, in what quantities, and we're able to establish that. And then number three, regulation. What do we need to do in terms of laws, regulation, policy to ensure that we can enable our farmers to produce safe pork and supply in terms of laws, regulation, policy to ensure that we can enable our farmers to produce safe pork and supply the market.
And Absa Bank Kenya has formed a strategic partnership with Trans-African Motors to support businesses in the transport and logistics sector. The collaboration is designed to help companies expand and improve their operations by making commercial vehicles ownership more accessible. Through this partnership, customers will benefit from tailored financial solutions that reduce the burden of upfront costs. Businesses can access up to 90% financing with repayment periods of up to 72 months. The initiative targets companies looking to acquire new trucks or upgrade their existing fleets, enabling them to operate more efficiently and competitively. This move is expected to strengthen the logistics industry by giving businesses the tools they need to grow and meet increasing demands.
The signing of the MOU marks the culmination of the long partnership with Absa Bank, with the aim of bringing affordable financing. The synergy of the partnership ensures easy access to reliable vehicles at a very flexible finance.
Providing the financing product, which is a very, very important part of what we do as banking. Many times you find SMEs, large corporates, people try to fund such assets from own cash, which can be quite stressful in this difficult. At times you find SMEs, large corporates, people try to fund such assets from own cash, which can be quite stressful in these difficult economic times.
And finally, it's a wrap for EBN News at 1 p.m. Many thanks for watching. Coming up next is the Manifest Show. Stay tuned.